We are starting this new exotic pet healthcare series in order to help educate everyone out there a little bit more about what exotic pets need, what sort of problems we are presented with in the veterinary hospital, and what sort of issues we have to deal with, what medications we may be using, treatments we're doing, procedures, surgeries, all that sort of stuff, all with the goal of trying to prevent disease, maintain health in pets, and treat problems when they arise. So this is the first of the series, but you will be seeing us doing a lot more down the road, and getting a lot of good information out to all of you guys. So let's go ahead and get started. Oh, if this will advance. There we go. So this very first inaugural lecture is going to be on the first thing that we often do when a pet comes into the office, which is the physical examination. And there's me doing a physical examination on a turkey. All right. So what is a physical exam? I want to just introduce you guys to what it is that we're doing so that you have an idea of what happens when your pet comes into the hospital. The physical exam, really, we need to think of it as the first test that is done to help a veterinarian get an idea of what could be causing an animal to be sick. It helps us to get a list of possible additional next steps we need to do. It tells us, okay, well, there might be this problem over here. What do I need to be thinking about as a veterinarian to determine what diagnostic tests I should run, or what treatments do I need to be doing to help this animal out? And it allows us to follow up and reassess how the animal's doing. We do our physical examination when they first come in, but then if they're staying with us hospitalized, then they're going to be getting a physical exam maybe a few times a day so that we can follow up on them during their visit to tell if they're improving or if anything's changing in any way. When they go home and come back for a recheck, we're going to be doing our physical exam again when they come back for their recheck, because we need to follow up and see, is the animal improving and getting where we want them to be. So I'm going to go over exactly what it is we're looking at, because sometimes it can seem like a little bit of a mystery when you bring your pet to the office. Your pet gets placed on a table and you can see the vet looking at it and touching it. Some vets are very vocal about what it is that they're doing and what they're looking at and describing things for you, and other vets are a little bit more quiet. But we're really all doing the same thing. And so I want to just describe that to you. So I've broken this up into the different species that we commonly will see. So the first one we're going to be talking about is our rabbits and our rodents, or some of our smaller mammals that we see. We often will start from the top and work our way down. Well, at least that's what I do. Every veterinarian is a little different in kind of where they start their examination, but most veterinarians do start at a particular location and then work around the body to complete the full physical examination. A lot of times owners want us to look at the problem area right away, and I totally understand why an owner would want us to do that. But it's still helpful for the veterinarian to start in their typical manner, proceed from the beginning of their physical exam to the end of their physical exam the way they normally will do it, because it helps the veterinarian not miss anything. Sometimes if we go straight to the problem, we can get tunnel vision, because we look at the problem and go, oh my gosh, here's all the things that I need to do. And we get ahead of ourselves and may not look at the rest of the animal when other things need to be looked at. So it's really important that the veterinarian look at everything the animal has on them, essentially, and often best for the veterinarian to start in a very a normal pattern that the veterinarian prefers to do. So for me, I start from the top. One of the first things I'm looking at is the eyes. And when I'm looking at those eyes, I'm really looking to see, are the eyes symmetrical? Is there any discharge from the eyes? Is there any redness? And I'm looking not only at like the eyelids themselves for redness, like you can see in this rabbit in this picture here. He's got nice pink little eyelids. That's great, normal. I'm looking to see if it's red around there. But then I'm also kind of lifting that eyelid up, and I'm looking at the conjunctiva, which is the pink portion of that eye, around the eye itself, and I'm looking at the sclera, which is the white portion of the eye, see if there's any redness there. I'm looking for any swellings. Is there anything that is ballooning out in some way that it's not supposed to? As we move along, often looking at the nose is one of the next things. really, main thing I'm looking for on the nostrils is there any discharge? Is there any moisture? Is the fur around the nose dirty in any way? I'm looking to see if a nostril is occluded with material. And also, looking for any lesions on the skin around the nostril. Next, we'll proceed to the ears, and it's important that we look down the canal. We look at the ear itself, like the lobe of the ear, but then also down at the canal, looking internally to see what's going on in there. Are there any changes to the normal structures of that ear canal? Is there any debris accumulating? And if there is any debris accumulating, what is it? Is it just normal, what we call ceruminous debris, which is the normal waxy stuff that is produced from the glands within the ear? Or is it something more than just wax? Is there any odor to it? If there's odor to it, we worry about infection. And when we worry about infections, there's different types of infections that could potentially be present. We're also often looking down to the very base of that ear, trying to see if we can see a structure called the tympanic membrane. The tympanic membrane is just tiny little membrane that exists at the base of the ear that kind of separates it from more internally. We want to make sure that that's not damaged, torn, irritated in some way. With the mouth, when it comes to our rabbits and rodents, a lot of times we look at the fur around the mouth to see, are they drooling? Are there any incisor changes? Is there any like redness to the gum tissue in any way? But then it's also extremely important for our little rabbits and rodents that we don't just look around the mouth and at the incisors, but that we actually look further back in the mouth at the cheek teeth to see if there's any changes there. And here's just some pictures of looking at the oral cavity of a rabbit. At the top there, you can kind of see somebody's sort of pulled back the cheeks a little bit so that we can see those incisors. The incisors are the teeth that are right up front. Technically, there's actually 6 in the rabbit because there's 4 on the top. There's 2 tiny little peg teeth right behind the front large incisors, and then 2 lower incisors. And then when we're looking at the back of the mouth, we're usually using certain tools that allow us to get a better visualization of the cheek teeth. And so if you look at the lower picture there, this patient is actually under anesthesia in this particular picture. Sometimes to get a better look at the back of the oral cavity, we need either sedation or anesthesia to get a real thorough evaluation of the cheek teeth done. But you can see there's some tools there that are helping opening that mouth up a little bit better so we can actually see further back in the mouth and actually look at those premolars and molars, also known as the cheek teeth, to say, are these an appropriate height? Are they an appropriate shape? Are all the teeth there, or are they missing some teeth? Also looking for any abscess material, any lacerations on the gum tissue, cuts, those sort of things, overgrowth to the teeth. We need to see all that stuff, and it usually requires a little bit of some help with either specialized tools or some sedation or anesthesia to really get a good look in that oral cavity. As we move along the rabbit, we're looking at the skin. We're looking for any abnormalities with shedding, any weird flaking, any hair loss, any lesions on the skin, lumps, bumps, swellings. We're also feeling for heat. Heat is an indication of inflammation. And so just getting our hands on them and actually feeling for that is really helpful. Also, as we move along that body, when we're assessing the skin, oftentimes at the same time, we're assessing the musculoskeletal system. So the bones and the muscles, the joints, all of that. We're looking at the limbs to make sure that they're symmetrical, that they're not holding a limb in an abnormal way, abnormal posture. We're also feeling, again, for any swellings, any heat that can indicate some inflammation going on. When we start to listen to them, or focus on the chest, we're listening to the heart, getting a heart rate, and listening to the rhythm of the heart, listening for any murmurs, that sort of stuff. And then when we are also listening around that chest, we're not only listening to the heart, but we're listening to the lungs as well. And when we are listening to those lungs, we're assessing for, is there any crackles, wheezes, harshness that is present that we're not supposed to hear? Or is there sort of a dull sound? Am I maybe not able to hear lung sounds the way that I normally should? All those different things can make me think of different problems. And then we're also, just assessing their breathing rate and effort. Are they working hard to breathe? Are they breathing rapidly? Are they breathing too slow? A lot of our small mammals will breathe sort of fast. And sometimes if they're breathing slower than what we would normally see in a veterinary hospital, that can be indicative of, well, something's not quite right with that respiratory system. As we move further back, you're going to often see the veterinarian feeling the abdomen, kind of pushing on the abdomen. And the reason that they're pushing on the abdomen is because they're trying to feel the internal organs. There's really a lot of stuff to feel in the abdomen. And depending upon the species that we're talking about, there may be certain things we feel easier and certain things we don't feel as easy. I have made little arrows here to kind of point to where different things are and what we are feeling for in those different locations. But, we're feeling for the stomach. We're feeling the liver. We're feeling the intestines. Is there any gassiness in those intestines? Is there any pain when we palpate the intestines? We're feeling a little higher up to feel the kidneys. Feeling for any swellings. Does it feel like one's bigger than another? Are they painful when you feel near the kidneys? We're feeling the bladder, making sure that it's not too big. Feeling sometimes with certain individuals, you may be able to feel stones in there. Or something that feels like a sandbag that can be indicative of bladder sludge. And then I also wrote plus or minus reproductive tract because, well, some of the animals that are coming in are spayed and neutered, and we don't necessarily have a reproductive tract organs to look at because they have been removed. Or there are certain individuals where they're not spayed or neutered, and we have to really be assessing those areas where those organs lie to make sure that those organs are healthy and normal as well. As we move further back, I wrote genitourinary rectal area. We're looking for swellings, discharge, redness, crusting. We're often taking a temperature while we're back there as well to make sure that the body temperature is okay. For some of our rodents who are a little smaller, we may not be doing that because it may be a little too invasive for some of the real tiny guys. And when we're looking at the feet, we're looking for, is there hair loss for those individuals that have hair on their feet, like rabbits? Is there any swellings? Is there scabs? Is there pus there? For those individuals who don't have hair, like maybe our little guinea pigs on the bottom of the foot, we're still looking for swellings, we're looking for scabs, we're looking for pus, we're feeling for heat, but we're not really necessarily looking for hair loss if there is no hair loss or no hair normally there. So we're also doing something to assess the hydration. And this picture is sort of showing what exactly that is. You can see the individual with this rabbit is holding the skin up between the shoulder blades. And you can pinch that skin between the shoulder blades, lift it up slightly, and then let it go. And when you let it go, if it snaps back into place, the skin snaps back into place real quickly, then that means that they're well hydrated. But if it doesn't snap back into place real quickly and it kind of like takes a moment to go down, then that means that patient is a bit dehydrated. Now, just a little bit of specific stuff on the ferret. Again, a small mammal, but a little bit of differences with them that we might be looking at compared to the rabbit and rodent. We're still looking at their eyes, their nostrils, their ears, of course, like we are with the other small mammals. But with their mouth, I'm looking at things a little bit differently with the ferret than I am with the rabbit or the rodent. Ferrets have teeth that are more like our dogs and our cats. And so those teeth are not open rooted, they're closed rooted, so they're not constantly growing, where rabbit and rodent teeth are that need really close attention all the time. They have, their baby teeth and then their permanent teeth. And so they can get dental disease the same way a dog or a cat would, where they get tartar that builds up, and maybe they can get gingival recession, or they can get abscesses at the base of tooth roots and may lose teeth. So we're looking for all that sort of stuff. And ferrets in particular, we do see broken teeth with some frequency in them, particularly their canine teeth. They're good at being really wild and rambunctious and jumping off of things and getting themselves into trouble sometimes. And I think also because they just have sort of a low profile to the ground when they run around, maybe they bump into things more or chew on things. And it's very common that we'll see some fracturing of the teeth in some way in them. Again, we're still looking them all over the same way we are with the other individuals we mentioned, listening to their heart, their lungs, feeling their abdomen, assessing their limbs, looking at the genitourinary area. We're taking their temperatures, all of that stuff like we talked about already with the rabbits and rodents. Hedgehogs, a little bit of unique things with them. It is not uncommon for a hedgehog to require sedation or anesthesia as part of a complete examination. These little guys, they're cute and adorable, but they have those nice spines that you can see on the picture there. And those spines are really pokey and good at poking your hands, the veterinarian's hands, so they kind of feel things. But it's not even so much that's the issue. It's the fact that they have a strong muscle along their back called the mantle, and they can contract that. And as they contract that, they can kind of roll into a little ball, tuck themselves in, and then it's very hard to see anything but the skin on the top of the body. So sometimes these little ones require some sedation or anesthesia to allow them to relax so that we can do our complete examination. When we do our complete examination with them, really not any different for the things that we're looking at compared to the rabbit, the rodent, but they are similar to the hedgehog in that their teeth are not constantly erupting. They are close-rooted, and so same thing with them. They can get dental disease the way that ferrets can. One thing that we do unfortunately see more commonly in our little hedgehogs and is shown in this picture here is a little bit of redness to the gums. Now, sometimes that's just what's called gingival hyperplasia, where maybe there is inflammation to the gingiva, the pink tissue around the gum. And unfortunately, sometimes it's cancer that we see in that oral cavity. So oftentimes we need a biopsy to diagnose something like that, and we can't always tell that with our eyes. Sometimes the level of swelling that's present may make us more suspicious of things like cancer. But like in this case, I can't really tell if it's just gingival hyperplasia or if it's potentially cancer in the oral cavity. Okay, so those are our common small mammals that we will see in the office. Moving along to our birds. All right, we're going to start with a physical exam on the bird. Again, sort of the same way that we do with the small mammals, starting from the top, working our way down. Again, we're looking at the eyes, same sort of thing as we do with the small mammals, looking for swelling, looking for redness, looking for discharge, all that stuff. We're looking at the back of the eye to see the retina and see if there's any changes there. We're looking at the ears. Now, birds do have ears. This is a thing that sometimes we get asked, that, yeah, birds do have ears. They just don't have an ear lobe the way that mammals do. So underneath those feathers on the side of the face there, sort of just below and behind the eye, there is an ear hole opening. And so we're having to push those feathers out of the way to actually see that ear opening. We're also looking at the nostrils. Again, is there any discharge there? Do they look symmetrical? Is there any debris stuck in the nostrils? Is there normal airflow through those nostrils? And then with birds, because they don't have teeth, we're instead looking at the beak. How does the beak look? Is the beak symmetrical? Is it appropriate in its length? Are there any odd deviations? Are there any defects in the beak? We're opening up that beak as well, and we're looking into that oral cavity, which you can kind of see with this picture here. Now, in this picture, I'm using a little instrument to get a good look inside of the mouth of this particular bird. And, you know, I don't always use this particular instrument. There are a couple of other instruments that I'll use as well to get a look in the oral cavity, but this particular one allows us to get a better picture for the webinar purposes. And at the roof of the mouth in a normal bird, we do have a little slit called the choanae. And that little slit at the roof of the mouth, it actually connects to the sinuses behind the head. So it looks like this little sort of like almost triangular slit. And on either side of it, there's little projections called papillae. And they're these like pointed little cone-like structures. And we're looking at those things to see if there's any abnormalities with them. Those choanal papillae can become blunted when there's vitamin A deficiencies, or if there's an infection in the respiratory tract, or an infection in the oral cavity. This bird here, you can see there's these like little white flecks in the mouth. This bird here actually had an infection in the oral cavity, and its choanae, again, the slit at the roof of the mouth that connects with the sinuses, was not quite normal. So you can't see it as easily in this photo because of the infection that was going on in that oral cavity. So we're looking in that mouth to look for that sort of stuff. We're also looking at the tongue. We're looking at the glottis, which is the opening to the trachea, and looking for any changes there. Now, as we move along the body of the bird, not too different from the mammal, there's just a couple of unique things to be aware of with the bird. when I work my way down, the first thing that I'm going to really be feeling for along that neck there is the crop. The crop is an organ it's a dilation of the esophagus. So we know when we swallow food, it goes down our esophagus and it goes down into the stomach. Birds actually have a dilation of that esophagus in the upper portion of their neck before it goes down into the coelomic cavity. And they'll store food a little bit there before it goes further down. So I'm feeling that to make sure that it doesn't feel irregular, gassy, that I don't feel any masses in there, foreign objects. As I work my way down, birds have a big bone over the breast area. It's called the keel bone. And it does preclude me feeling sort of much over that keel bone itself. So it kind of acts as this breastplate that sort of shields the internal organs to a certain level. I'm feeling that keel bone to feel the muscle mass over it, because the muscles that power flight are actually right over that keel bone. And so I'm feeling those muscles to see how does it feel? Like, do we have strong muscles that we could fly? Do we have weak muscles where maybe we, are not the best flyer, and over time we've lost some muscle mass? The other thing too is that muscle mass in certain species will give us an idea of if they're a good body condition. So are they overweight or underweight? And when we feel that keel area, if it feels too ballooned out, then they're overweight. If it feels too sunken in, they may be underweight. Now, birds have, as we move along, they have limbs, of course, like our mammals. When we talk about forelimbs and hind limbs in mammals, in birds, we talk about their wings and their legs. So I'm feeling along their limbs, just like I do in a mammal. They're just a little bit different as far as positioning goes, right? So I feel all along the length of the wing to feel the bones along the length of the wing. I stretch that wing out to assess the joints and assess the ability of how well they have range of motion. As I work further down, feeling the abdomen. Most of our birds, they have a concave abdomen where the abdomen kind of is tucked in. And so I'm wanting to feel that abdomen to make sure that it is concave and that there isn't anything that's protruding out in any way. Because if there is, that could indicate certain problems. We talk about the vent in birds. So the vent is the common excretory organ, the opening to the common excretory organ, the cloaca, where they have everything. Their poop, their pee, and reproductive materials coming out of that one particular area. So we have to check that out and make sure that area looks fine. Assessing their feet, making sure that they've got good grip strength with their toes. Birds are perching on our perches, like in this photo, many of our species. So we need to make sure that those feet are grasping appropriately, that they have good strength, normal nervous system functioning, normal tone, and making sure the bottoms of the feet look healthy, that they don't have any redness, ulcers, abscesses, anything like that. And then with their tail, birds have sort of a short little tail, but we're assessing that to make sure that the feathers look okay and that there's no problems. Now I put plus or minus preen gland. Certain species have a little gland at the base of the tail, like from the back area down at the base of the tail. There is a little lump, and it's usually a bilobed lump that produces oils that the birds will go to. You'll see them when they do their grooming, and when a bird's grooming itself on a perch, and they kind of tuck their head behind themselves and they're doing something by the base of their tail. They're often grabbing some oil from that preen gland and then they're spreading it across their feathers. Now, not all birds have preen glands. The Amazon parrot in this photo does not have a preen gland. They're one of our parrots that don't have that, so we don't have to look for it in that particular set of parrots. All right, we'll move on to the reptiles now as our next set of animals. Again, we're looking at very similar things, whether it's mammals, birds, or reptiles. Eyes, nostrils, ears. Things may just be in a slightly different location. Now, some of our reptiles with their ears, particularly our chelonians, or turtles, tortoises, terrapins, they have just this flat skin sort of covering. And the picture here, you can see I have a little arrow pointing to where the ear is in this particular species. And so if you look closely at your pet tortoise or turtle, you'll see oftentimes a little circular spot. That's where the ear is actually right underneath there. So it doesn't have an external opening like we see in our birds and our mammals in the chelonians. But it is there, I promise. Looking in their oral cavity, just like we want to do with our other species, because birds and reptiles are, very similar, there are some similarities in the oral cavity depending upon the species we're looking at. I mean, if you look at a tortoise in this photo here, you can see the tortoise has a beak, right? Just like a bird has a beak. It's different, of course, as far as the kind of occlusion, the anatomy a little bit, but they're very similar. Versus the snake at the bottom there, he doesn't have a beak, obviously. He's got little teeth and everything, but he's giving us a good view of his mouth. As we move along, again, we're just feeling the musculoskeletal system. What do the bones feel like? What do the joints feel like? We're feeling their abdomen, same way we do in a mammal. We're kind of compressing in there and just feeling for any odd lumps, bumps. What do the individual organs feel like? In the reptiles, like our lizards, we can feel that stuff a little bit similar to the mammals. But like birds, it's harder to feel some of those more specific individual organs because we don't have as much area, because the keel bone in the bird is covering up our ability to feel a lot of internal organs. Reptiles do have a vent, same way that birds do. So we're just checking out that area, making sure that it's okay. And reptiles, a lot of them, well, our lizards have often a much longer tail, that we're just feeling the fat stores that are in there, feeling the muscle mass, making sure that they have a nice kind of meaty tail, or are there any problems with it, going to the tail tip, assessing to make sure that there's no changes to the tail tip. There's certain species where we see like vascular problems with the tail tip, or some little individuals who maybe got bit on the tail and had some trauma. So we're checking those sort of things out. And then, of course, with them, we're looking at more their scales. Of course, scales are skin, but we look at those scales a little bit more closely. Differences amongst the reptiles. Abdominal palpation, when I'm feeling that abdomen in a snake, it's just very long, right? The snake is just this long tubular animal. And so all those organs are inside of there. And a lot of times what you'll see a veterinarian doing who is examining a snake, they'll hold the snake and they'll kind of run their hands down that snake, kind of just lightly compressing into the abdomen so that they can try to feel any internal structures. You can see in this photo here, this little individual actually has a little bit of swelling on the abdomen. And then when it comes to our chelonians, our turtles, tortoises, terrapins, well, they make things a little bit more difficult because they have that lower shell, right? That shell, the upper portion is called the carapace, the lower portion is called the plastron. That plastron really does prevent us from getting a good feel into the abdomen. So I can't have as much of an ability to feel individual organs in the turtles, tortoises, and terrapins as I can in a rabbit. But I can feel some things. And usually what you'll find a veterinarian doing is they'll kind of put their fingers into what's called the prefemoral fossa, or like the inguinal region. So by those hind limbs, if you look at this picture here, you'll see there's like a space between the upper and lower shell. And so we'll put our hands up into that area and kind of feel just the edge of the abdomen, and we can rock the tortoise or turtle back and forth from side to side. And we may be able to feel something bumping off the tips of our fingers, any sort of bladder stones that we see frequently in our desert tortoises, or maybe a female that is gravid, so she has some eggs in her. Or sometimes if one of these guys eats too much gravel, we might feel some gritty stuff in there. So they make it a little bit more difficult for us, but we work around it. Okay, we're going continuing along with more of our exotics, and now we're going to talk about the fish. Many times people are like, how can you examine a fish? Well, it's an animal that has eyes and a mouth and, skin. So we're really looking at all those similar things that we're doing with our more traditional terrestrial animals. I'm looking at those eyes. I'm looking at the skin for its health. Now I'm looking, instead of legs, I'm looking at fins. Their pectoral fins, their pelvic fins, their tail fin, anal fin. There's, various different types of fins that we have to assess it's really kind of telling us more about their skin health additionally. But looking at how they're moving them, looking in the oral cavity. Some of these guys allow us to get a little look in the oral cavity. Some are a little harder to do, depending upon the size. And then we're looking at the vent as well. Again, that common excretory organ that we saw in the reptiles and the birds, we're kind of looking at that. Now, some of these guys may require a little bit of sedation for us to do stuff with them. we want to keep our patients as low stress as possible. And, fish aren't used to being touched by people. So sometimes a little bit of sedation, anesthesia for them can be helpful for us to get an examination done, but not stress them out. And invertebrates as well. Nothing is off limits. So we do certainly see invertebrates in exotic pet medicine. It's mostly the spiders that we'll be seeing, mostly tarantulas. But here's actually a picture of a pet black widow spider that had come in. Now you can see that this tiny little guy does make it a little bit more difficult for us to do some certain things, right? But we can still do some level of physical exam, even on this tiny little spider. What you can see the veterinarian doing here in the picture is they have some glasses on that actually they're called loops. And those loops are helping to magnify so that she can look at the patient a little bit more closely. And she was able to see, his eyes, mouth parts better, and get a little bit better look at like the surface at the joints of the limbs and everything to make sure that everything looked appropriate health-wise for this little guy. Now, this is a black widow spider, so it's going to be, maybe one that we're not going to be touching so much. So certain species where we have to be more hands-off because of one reason or another, we start to get creative. And you can see this little guy, he was just placed into a little container with saran wrap on the top, and he climbed up on the saran wrap, so we were able to look at his underside without having to touch him and upset him in any way. So all right, so that's the basics of a physical examination with our exotic pet species. And I again wanted to just go over it with you guys because a lot of times people don't know how much is actually happening in that very basic physical examination that your veterinarian is doing as the first thing when a pet is coming into the office, and how much information they're actually getting from looking at the animal, touching the animal, feeling it, listening to it, how it really helps guide the veterinarian know what to do as the next thing for their pet or your pet. So I'm going to stop sharing my screen, and I'd love to take any questions if anybody has any.
Well, thank you so much for your presentation, Dr. Lamb. I'm sure a lot of us really appreciate you sharing your knowledge with us.
Yeah, no problem.
As an exotic pet owner like myself, it's really comforting to know how extensive exams are because, like you said, there's some uncertainty there as like an owner, what exactly is going on back there. So thank you.
Yeah.
This would be the perfect time to put questions in the Q&A. So while we wait for that, I would like to ask questions if that's okay.
Sure, go for it.
How often should your pet get a physical exam, and is it different depending on the type of exotic pet you have?
Sure. I would say, generally speaking, we will often tell people we want an annual examination done for a pet as just sort of a across the board general rule. Now, that can vary from one species to the next. Like if we have a species that has a shorter lifespan, for example, a hamster, a lot of them only have a lifespan of, maybe 3 years or plus or minus a little bit. So those guys, it may be better to do like 6 months, every 6 months, an examination with them versus some really long-lived species. Like let's say we're talking about a sulcata tortoise who has a very long lifespan. We still recommend annual examinations for them because it's good for us to take the time to make sure all the husbandry is appropriate so we're not having any issues happen in the future. But, if something happens one year and an owner isn't able to get them in maybe 1 year and maybe they have a gap of a year or two, well, that's okay. We can deal with that. They're a longer lived species, so I may be a little less concerned about being monitoring them really closely. Also, it depends on the age of the animal too. So if we have a younger animal, maybe they need to come in a little bit more frequently upfront because of certain young animal problems that we will see, or they're getting spayed or neutered or what have you. So we may see them more frequently when they're young. And once they hit a year of age, then okay, we don't need to see you so frequently. But if they're older, we have an animal who is, an elderly, a geriatric, well, then maybe them I want to be seeing maybe every 6 months as well too. And of course, if we have any animals that have certain chronic illnesses, that definitely changes things. Because depending upon the chronic illness that they may have, we may need to see them every 3 months, every 6 months, what have you, to do blood work to make sure that things are going okay with them.
Thank you. We currently don't have another question, but oh, actually, we do have a question from Quinn. How do you examine a guinea pig?
How do you examine a guinea pig? Okay, well, so again, it's kind of like we were talking about with the rabbit and rodents, because guinea pigs technically are a rodent, were sort of the first part. I would say, anything like that's different with them, they sometimes want to like maybe move a little quickly and run off. And so we have to be very cautious with them, holding them securely, not tightly, of course, because we don't want to stress them or cause them any problems, but securely holding them so that they can't scurry off the table or anything like that. But still looking at all those individual structures that we talked about, and looking at the teeth in them, it's really important that we look at the teeth to make sure that they're a normal height, a normal shape, that there's no odors in the oral cavity, is really important.
Okay, we have another question. Do you
Okay.
recommend spaying or neutering reptiles and small animals like hamsters?
Oh, that's a really good question. So we do recommend spaying and neutering. Certain species, we certainly do it more. And like for sure, the rabbits, we highly recommend spaying and neutering for them because there's certain diseases that we see in the like female rabbits. They get uterine cancers very commonly, so it's really, really important that they get spayed. We do recommend that the guinea pigs, the female guinea pigs, get spayed because they also, as they get older, they can develop certain ovarian problems. So there, we highly recommend. The male guinea pigs, they may be prone to sometimes getting changes with their like rectal area as they get older, but doesn't happen in every individual. So we recommend neutering them. Same thing with the rats. We recommend spaying and neutering. Now, when it comes to the little hamsters, you know, I haven't seen as much male problems, male reproductive tract disease in them. So I would say that I don't necessarily do it routinely. But the females, I have seen certain reproductive tract related diseases. So it's never wrong to prophylactically spay a hamster. I would say we don't do it a ton. That may be more because of, our part as veterinarians maybe need to do a little bit more education for the general public of, hey, we can see these certain reproductive tract diseases in the hamster, so it's not a bad idea to get them spayed. But we don't see it in a large volume of hamsters. So, they're one of the species that not everyone is going to have a problem. So I'm not as worried about them as I am the rabbits, who have a really higher prevalence. When it comes to the reptiles, it kind of depends on the individual species, and it also depends on what the owner's goals are. I would say we do spay a lot of bearded dragons here. Now, we usually are doing them more when there's a disease process going on. And maybe that's something as we learn more and more about these species, maybe in time we'll be saying, yeah, we should be doing these more prophylactically. Here in Arizona, we have a large population of desert tortoises. And so we do like to spay the females. Now, we don't usually neuter the male desert tortoises because there's a little bit of differences in anatomy and some difficulties there. But we do spay the female desert tortoises as a prophylactic thing so that they're not having more babies. When it comes to the birds, we usually do not do any spaying and neutering prophylactically. They're just anatomically a little bit different, so there's some greater risks with the procedure. We usually are not doing neutering unless there is a real big problem the vast majority of the time, and even then it's a pretty difficult thing, and something that you definitely need to talk with a veterinarian about. It's not routine in any way. But when it comes to the spaying of the female birds, if there is a problem, then we may be going forward with a spay in a female, but that's still definitely something that is made based off an individual problem. An individual who's having a problem and determining if it's right for that individual, because there are certain complications that can occur with those particular species when it's not as simple as doing it prophylactically in our mammals. So.
We have 3 more questions. Is that okay?
All right.
Are there certain things you look for in bearded dragons?
So again, sort of just doing the broad physical examination, but specific things that I may be looking at very specifically in them. I'm looking at their teeth. They do get dental disease. Their dentition is a little bit different than our mammals, but we actually can do dental prophylactic, like scaling and polishing of the teeth with them. I'm because they have the bones in their beard. I may be palpating those and feeling those. They've got big fat pads in the back part of their abdomen. I'm feeling those to kind of tell, like, what's their nutritional status sometimes to assess if they're overweight or underweight. And then, yeah, I mean, other than that, like those are maybe just real specific to bearded dragons. But other than that, it's sort of the broad general physical exam, like as in other reptiles.
I believe you touched on this a little bit, but are there any dental prophylactic treatments available for those exotics with the closed-rooted teeth?
Yeah, for sure. The ferrets, there's a nice picture of a ferret right here. They do get dental tartar, and we absolutely can do dental prophylaxis with them where we scale and polish those teeth. Now, they do usually require anesthesia because they are not excited in any way about having their teeth cleaned. We don't want to stress them. We don't want to cause them any problems. We don't want them moving. So we do usually have to put them under anesthesia, and then we can scale and polish their teeth and keep those teeth healthy.
And then our final question, I believe, what is the best way to hold a small bird during an exam so they are secure but safe as we look at those different areas?
Oh, that's a great question. I apologize, I didn't have a good picture of a small bird being restrained. I'm sure in future webinars we can get a good picture of that. But usually we will use a towel. In some really tiny birds, some of them are more stressed by the towel, and so there are certain individuals where I just use my hand. But like what I'll do is I'll actually hold the bird at the base of the mandible. So like I actually put my hand sort of around the back of their head and hold with my fingers at the base of the mandible. And then the palm of my hand, their back is against the palm of my hand. And then their wings are kind of kept in place by being tucked in on my fingers and the side of the palm of my hand. So make sure to have a picture in the future so you can see it.